You can narrate.
So what we're doing is we're looking at the AC joint under ultrasound. You might want to see it from this end. We can compare the left and right. Here's the right, and then here's the left. Sorry to move these. Seems to get a good view. You can see how much more scraggly the right side is compared to the left. It's really smooth. This is the joint capsule. You can see how there's a nice linear line here, whereas here it's disrupted on the clavicular side. So that's the clavicle right there. So at some point there's evidence that she probably tore this capsule right here, which makes this joint loose, and rather than it staying in put whenever she moves her shoulders, it's wiggling around, and a joint that wiggles is going to erode much faster than a joint that stays stable. So until that ligamentous structure, the joint capsule, can be restored, it's going to be a dynamic joint, which is going to cause her arthritis over time. So what we want to do is provoke that capsule so that we can make it stronger and stabilize it, hence prolotherapy or proliferative therapies.
So this will basically make it so the ligament heals tighter again?
Correct. So this is going to reinitiate that repair mechanism or create awareness, because your body, after a while, that capsule scars over and it doesn't think that there's any problem there. It thinks that this is just the way things are supposed to be. Scar tissue is never as tight and resilient as is normal fibrous tissue. So what we're doing is we're breaking up the scar tissue and creating an incentive for your body to reinvigorate that repair process, or reinitiate that repair process.
Interesting.
Right, so
impressive this can be done without surgery.
Yeah, exactly. In fact, surgery would make it worse because you're creating more scars. And pinch, ready?
Doesn't look too terrible, Kaylin?
No, not too bad.
Wow, great.
So you can see the needle actually in the ultrasound. Right there. Like bright shadow right in the center of the joint.
Right about there?
Keep going to the right.
A little bit
The
more.
line, the straight line.
Oh, that thing.
Yeah.
Ah, gotcha. Yeah, that's huge.
Yeah.
How could I miss that?
You can see the fluid going into the joint. And
yeah, wow.
there's clearly a tear in the joint, because if I'm inside the joint like that, it shouldn't leak out.
Wow. Amazing.
How's the pain?
It's okay.
So now I just want to pepper
Okay.
the outside of that capsule. If I hurt you, let me know.
Okay.
A little bit more there.
It's amazing because the patient can actually see it on this big screen too, how it is. Oh, I see that. Wow. Very cool. And Kaylin, this isn't terrible?
She's like,
No.
Wow. I like it. Something that doesn't hurt that bad and can prevent surgery. Wow. I would have thought that surgery was necessary for something like this.
yeah. As a dad, I'm sure you appreciate that even more.
Oh, yeah.
Alright, that's gonna get sore for a few days.
Alright.
Maybe a day or two since you're young and you heal so quickly.
How long do you think she should be out of sports for?
I would keep her out for 2 weeks and let that heal, but at the same time, I want her to start doing some rehab
I think
exercises.
wrestling's canceled till December.
Yeah, start doing some rehab exercises in about a week. Within 4 to 6 weeks, I would be okay with you going back to sports.
Do you think that the MLS laser system would be able to help out with her
For
recovery?
sure, particularly because this is such a superficial joint that penetration of the laser would really help. I mean, the laser would help increase the circulation, and just generally speaking, the way your body heals from injury, it's when you tear something or rip something or damage it, there are small blood vessels in that area which rip as well. That bleeding brings in platelets. Those platelets are responsible for stopping the bleeding or coagulating the blood, but their more important and lesser appreciated role is to slowly release growth factors over time. And those growth factors are what recruit cells to the area to do the damage repair. So essentially right now what we're doing is we're creating a chemical stimulus for that migration of cells, as well as creating enough disruption in the area where there's going to be some small amount of bleeding that will recruit. We'll do the same thing, but if it were more damaged, then I would say we should probably do a PRP. But I think the combination of prolotherapy with the laser, and I forgot to mention what the laser does. The laser will increase the circulation in that area, and the difference between chlorophyll, which is the energy producing component of leaves, and your blood, which has hemoglobin, is just one molecule. It's iron for blood and magnesium for chlorophyll. But otherwise the molecule around it is the same, the porphyrin molecule. So there's a theory that laser or certain wavelengths of light will activate or will energize the hemoglobin and increase the release of oxygen in the area that's being lasered. Another theory is that mitochondria are deemed as relatives of chlorophyll because they're both energy producers in cells. There's some activation to the mitochondria as well. So for whatever reason, in veterinary science, they've done a lot of research in this, but the laser creates an increase in metabolic activity in the area that's being lasered, as well as increase in circulation. And circulation is what we need to help heal injuries.
So it sounds like the prolotherapy caused controlled irritation, and the laser's going to give it some good energy and nutrition for it to heal better and faster.
Yep, along with dietary supplements like collagen, vitamin C, just a general balanced diet. Those all will give you the building blocks to put things back together.
Awesome. Now that wasn't too bad, was it, Kaylin? All right. Number 4 ranked wrestler in the state. Won't have to miss the season because of surgery. She'll be right back at it. Cool. All right. Thank you.